Hello and welcome to Taking the Supply Chain Pulse. This is Megan with St. Company here to introduce Matt Arsenault, the Executive Vice President and CFO of Baptist Health of South Florida. And now, here's our host, Fred Kranz.
Today, we have a first. We have our first verified CFO from a major IDN in the country to talk to, and it just so happens to be my favorite IDN in the country, Baptist Health of South Florida. It's my favorite because that's where I started my career. So we are pleased to welcome Matt Arsenault, the Executive Vice President and CFO of Baptist Health of South Florida. Matt, thanks for coming on our program.
Happy to be here.
I was looking today in my big green book that I got from Brian Keeley about the sort of the evolution of Baptist Health of South Florida, and it occurred to me that we live so much in the present that folks don't know how things got to be where they are. And I want to take people back with you today, and I'll probably talk more than I should because of the first part at least, and show people how systems evolve. And when by that I mean I got out of the Navy on June 25th, 1969, and was at Baptist Hospital working that the next week, okay? And at that time, I lived in Coral Gables. I was going to go to the University of Miami, and I didn't know anything at all about the hospitals. So I'm working at Baptist, my first civilian hospital I've worked in. And then I hear these names about, Doctors Hospital. I hear South Miami Hospital. You hear all these hospitals all around. And as time has gone by, what I realized is in that day, the sort of prototypical, stereotypical healthcare situation was a community with several standalone, not-for-profit community hospitals. If you were to ask someone in Miami in 1969, what's the biggest hospital in town, they would have said Jackson Memorial Hospital. Mm-hmm. It was the biggest. Mm-hmm. Baptist had the second most active ER, and it was way, way, way less active than Jackson. So as time goes by and as the system succeeded, it also came up with challenges. And somewhere I read, and I was reading something that Brian Keeley, who's your president emeritus, I don't know what you want to call him, but
right.
He said that we knew we had to do something or we weren't going to continue to succeed, and that hence the formation of Baptist Health of South Florida. And I also, having been a University of Miami Hurricane, I realized that Brian Keeley stole his strategy from Howard Schnellenberger, who said that we will take all the people from Interstate 4 south and call that the state of Miami, and we will win the national championship. And I looked at the hospitals here, and you have 11 hospitals, 3 of which are sort of subsets of others. So the hospitals are Baptist Hospital Miami, Boca Raton, Doctors in Coral Gables, South Miami Hospital, Mariners in Tavernier, Fishermen's in Marathon, Bethesda, and Homestead. All of these were standalone independent hospitals from independent communities along the way that were doing all right. And the other thing that Baptist Hospital shares with the University of Miami is that neither of them are in Miami. One's in Coral Gables and the other one is in Kendall. So the other thing that's interesting about Baptist, you've been there since 2006. So you got 19 years of continuity. Brian Keeley started there in 1969. He started there just after me, and he retired, 2 years ago?
Yep, 3 years ago, yeah.
The system is only, if the Wikipedia says it was founded in 1960, which means it was Baptist Hospital was founded then, but there have only been 4 CEOs of the system. 4. It's like the Pittsburgh Steelers.
Yeah.
3 coaches since 1967. So you've got continuity. So could you tell me a little bit about your experience of how the system has grown and your strategy of staying in the same geography? Could you give me a little bit about that?
Sure, happy to do that. Yeah, as you said, I started at Baptist in 2006, March 1st, 2006. So I've been just past my 19-year anniversary here, but I was actually involved with Baptist prior to that. I worked in public. My first job, I taught high school. Then I went back to school, became a CPA, went to public accounting, and worked for Deloitte. And for about 2.5 years, Baptist was my client. So I see them on the audit side, really understand the finance team, and get to know the organization deeper than just being a member of the community where it was. So, opportunity to kind of come over, did that through the accounting track. And at that time, coming in '06, it was a little over 10 years ago in '95 when the system was truly created. It's when Baptist Hospital brought into it South Miami Hospital and Homestead Hospital, right? And really, they were struggling financially, at the time, those hospitals. So Baptist, brought them in to the fold. And then really that was just the beginning of just a transformation of growing, providing care within our community, building a new hospital out in West Kendall, growing to the Florida Keys with Mariners Hospital and Fisherman's Hospital. And then Doctors Hospital was actually an acquisition from for-profit system, at that time, HCA. So, that growth in Miami-Dade and Monroe County was really, I was part of that. That Doctors was just before then. Really, that growth in Miami and in the Keys. Most of that was, systems that were having some financial distress. Baptist Hospital was, operated very well and had a lot of financial strength. A lot of that, my predecessor, CFO Ralph Lawson, really, former Deloitte partner, did an amazing job of really focusing on building, the financials of an organization to be generational, right? You want that generational last a long time. So how do you manage it in a way for the long term, along with him and Brian Keeley? So really that's when I came on board. I came on board, after some of those acquisitions, but before we started building new facilities. And it was really, a lot of it was growth in the outpatient at that time. It was, how do we get out there? How do we be in the community, right? And be there where patients need us. So huge outpatient growth of urgent care centers, outpatient imaging centers, sort of decompressing the hospital. I think we were really ahead of our time in that concept of, hey, you need to kind of have these smaller satellite locations where people can, have better access to care. It's patient centered. It's easier for people to do that. So really, that was kind of when I came on board, when that was really starting to hit its stride. Then like the transformation that came from there was, South Florida, Miami's an interesting community. You're familiar with it. South Florida really is kind of that Palm Beach, Broward County, at Miami and the Keys. It is kind of a unique place in that it's sort of, the joke with Florida is the South is the North and the North is the South. So you do see a lot of that Northeast influence, a lot of transplants from the Northeast, and sort of that, upper Midwest, a lot of folks there, combined with the culture of, the immigrant exile communities, Central South America and the Caribbean, Cuban American population. That sort of mix, I think, really defines a lot of the culture of Southeast Florida, right? So it just made sense for us to, start moving north with our outpatient strategy into Broward County, which is where Fort Lauderdale is. And Brian Keeley did a really good job of saying, hey, this community is growing. This is our bread and butter. This is where we have those connections. We know the community. So let's not get distracted by national, other parts of Florida. Let's just grow at our pace to meet our community need, and he kind of drew those boundaries. I said 4-county area. So we did that and brought on Bethesda Hospitals, 2-hospital system. That they had some financial challenges. Boca Raton Regional Hospital, outstanding system there, put their hand up that they thought, hey, that we need to be part of a system, and it just fit with our mission and fit with going with the community. And that's been, I think, a big success. Part of it is it's a supply chain podcast. Leveraging scale is important. And, we have a centralized distribution center that we built in Doral, Florida, which is pretty centrally located in northern part of Miami-Dade. And it just allows us to do all the things that we need to do to provide care in the community. So that growth just made sense for us. And then the other part, I think that is transformational, is just the growth of the employed physician group over that time. When I joined Baptist 19 years ago, we did not have any employed physicians. Now we have over 600 that are part of our medical group and centers of excellence as we work with academic affiliation and growth in that way. It's really super exciting. But that there are enough people to care for in Southeast Florida. So it was the idea of, let's not get distracted. Let's stay focused on being the best system in a world-class city and community of Miami and the Southeast region. So it's been exciting to be part of it. But and Fred, I'm sure if you've been down here, I mean, the community has changed dramatically since when it was just a single hospital at Baptist. But thankfully we've done an amazing job, I think, of growing along with it.
Yeah, Baptist is let's see if I've got the address right, 8700 North Kendall Drive.
Mm-hmm.
And when it was founded with Arthur Vining Davis of Alcoa's help, it was known as being on the road to nowhere.
Right.
Because North Kendall Drive was a 2-lane road that just shot out toward the Everglades, and there was nothing there. So, but how long was Ralph Lawson the CFO there?
Ralph, I want to say he came on board in the late 80s. I don't exactly remember when. Ralph was a partner at Deloitte & Touche out in Denver. That's where he kind of, super smart, moved to South Florida to lead their healthcare practice, and a partner at Deloitte, and then came over, I believe, in the late 80s. I don't remember the exact time with that, but really, and then he left, and I had the honor of getting the role as CFO in 2018.
Okay, well,
with that. So yeah, so he and Brian really, are credited with a lot of what we've built here.
Well, what's interesting is when you said that, I was trying to do the math. So Baptist has had 4 CEOs. They had the first guy that I can't remember. Then they had Ernie Knott. Then they had Brian Keeley, and then they had their current CEO.
Mm-hmm.
They've had probably only 4 CFOs.
I think that sounds about right.
The greatest of which, in my experience, yourself excluded, is Rusty Slay, who was there for the time I was there, and Ralph Lawson and yourself. And then they've had 4 supply chain leaders. They had a man named Leo Grizzle, who was the director of materials management. And then they had Frank Fernandez, and then they had Suzanne Thompson Quintero, and now they have George Godfrey. I don't think that you could find a system in this country that has had key leadership at those positions that has been as long-serving and such great continuity as Baptist Health. Is that a fair statement?
I think so. And I think that's a testament to sort of the culture and the values. I think a lot of us here on the senior leadership team are institutionalists. We make decisions that, thinking about, hey, this is where we need to, protect and grow this institution so that it's here for our grandkids, right? To do the great things that it's doing. So I think that's a mindset of everyone here, so that when when you're working alongside your colleagues and you're making difficult decisions together and you're strategizing together, when everybody's pulling the same direction, I mean, it's you get great things done. It's a great place to work. You don't want to leave, right? And that's really, all part of it. Part of it's also, Brian always had a thing called the no jerk policy.
Yeah.
If you're a jerk, it's just not, if that's your attitude, it's just not the right place for you. So when you show up for work every day and you got a bunch of people that abide by that philosophy, it's nice to come to work. So that's why you do have this longevity as well. So, and the commitment for care. It's the commitment to our employees and the commitment to our community. It's great. It's great.
So over the years, you've had, what's interesting is, I spent last week a couple of days at the clinic. I live in Cleveland, and they had a 2-day session there. The Cleveland Clinic is, by its own desire, a world-based organization.
Yep.
And they've got strategies for Northeast Ohio, for Florida, for Arizona, for Dubai, for London. I think there are way more systems with 11 hospitals than there are with gigantic outreach like the clinic. And I think that you guys could be a template for those, I would say, good-sized systems, but not gigantic. That's number one. But you have had incursions of competition. The not-for-profits have tried to get a chunk out of the South Florida market, and the clinic is they got their operations in South Florida. What has that meant to you folks as an operating challenge, financial challenge?
I think, our philosophy and my philosophy as well, which I think is shared by a lot of the leadership team here, is it's kind of the Amazon mentality of, yes, you need to understand what your competitors are doing, but don't let it be a distraction. You just focus on making the best product, the best product for your customers and your patients, right? And so that's, I think, what we do, right? I think we know, I think we have a pretty good formula. We get feedback from our community and from our employees, right? That we're doing well and we provide great care. So it's really, if you build it, they will come kind of thing. And if we keep doing what we're doing, we don't take for granted the trust that we have in our community, then, we will do fine with competitors, which are great. Cleveland Clinic's an outstanding organization, right? And they provide great care, and there are enough patients, right, for in the community, that both can provide great care. But that's really kind of how we look at sort of the idea of competitive forces. We just keep doing what we're doing, always continuously improving, and spread that, right? It's definitely different in Miami-Dade County, where we've been for many years, and in Palm Beach County, where not as many people know us, as well as people moving into South Florida, which has been huge, especially over the last 5 to 10 years. So it's, hey, we got to let people know us, who we are, what we stand for, and then usually when they're cared for by us, then they get it and they go, okay, all right, where are the pineapples in my community? That's where I need to go. For those of you that don't know, the pineapple is kind of our symbol of our organization. So, that's kind of been our philosophy in dealing with competition. Helps us step up our game. You need competitors to make sure that you don't get lazy.
Well, everybody knows you during the post-game interviews from the Dolphins because the pineapples are up in the background all the time.
That's right.
So that being said, what are your major challenges today, right now, and how are you dealing with them?
Obviously uncertainty with regard to government reimbursement, government payment programs, right? Every healthcare system in the country is dealing with that. we're kind of a little wait and see, on that. I mean, thankfully, we are in a position of financial strength right now. We're doing well financially, and our culture is to have reserves, right? So we feel that any storm that comes is not going to be able to impact our ability to provide care in the community. But that it's a concern. The uncertainty, kind of, hey, if we kind of have more clarity on what the path forward is, then we'll come up with a plan to make sure we can keep doing that. But that's the biggest. And then on the supply chain side, right? I mean, what is the sort of end game or clarity with regard to tariff? And they're obviously, like all health systems, we do rely on imports for a lot of supplies and pharmaceuticals. So again, a lot of that is a little bit of wait and see with that, but it could have a pretty material impact on us and a lot of all healthcare systems across the country.
That's an interesting thing that just occurred to me. If I'm selling my Dodge Ram truck that used to cost $80,000, and I don't know who the hell can afford one of those, but and now it's at $105,000 or $100,000, I can immediately pass that on to the consumer. But healthcare is not paid for and reimbursed in a straight line fashion.
Correct.
When your prices go up, you just can't add that onto stuff and pass it on to the consumer. And oh, by the way, you don't get paid in a timely fashion either. So the revenue that you're getting that comes into your place could have been something that you charged for a year and a half ago.
Yeah.
How the hell do you approach all that?
It's not easy. But I think part of it is we just have to be super efficient in our operations and what we do. And you just kind of have to deal with it. I mean, the hope is that, with, when healthcare, the cost of healthcare goes up broadly for things like that. We saw that significantly during the pandemic, and especially labor cost for clinicians. It's like really making sure that our government officials at the state and local level, as well as in the federal level, just understand that impact, so that when we rely on government reimbursement, that they acknowledge that, right, and can help systems. So we saw a little bit of that, which is good. And then we just have to figure out how to work with managed care as well. It does cascade through and just manage through it.
Yeah, I like that. You just the first sigh was when I started this question, and then we just manage through it, ends it. And I got to hand that to you. One of the things, I forgot when it was, maybe about 10 years or so, I was at a conference with Brian Keeley, and for you folks out there that don't know it, Brian Keeley, who was the CEO of Baptist, was my boss for 5 years. So we've been friends for most of my life. And the interesting thing about Baptist Health of South Florida, once again, got nothing to do with supply chain, but it could have something to do with supply chain, really. I asked Brian at that time, what's your turnover rate among RNs? And he said something, it's about 11%. I said, that's 11%. It's about 40% everywhere else. How come you don't have turnover at that rate? He said, because we pay them well. We take care of people. Mm-hmm. And I would imagine that probably extends to every department in the hospital. I know that at one time, another conversation with Brian was, didn't have caps on the salary at a position level. If someone was doing very well and have been doing very well for a long time, they might be making more money than perhaps the position itself would dictate. And these are just things about. That's why Baptist always ends up among the top 100 best places to work. And talking with George Godfrey, you have one of the finest supply chain leaders, smartest young guys around in the country. How has supply chain contributed to helping you in your challenges?
Oh, I mean, that you can't say enough. I'm glad you said it. Right, George is just fantastic, Like when you look at all, okay, what are the traits of a great leader? I mean, he checks all the boxes, right? Great, amazing communicator, great partner, knows the operations really deeply in what it takes to operate a successful supply chain. Great partner, all in on the mission of the organization, and just super smart. So the biggest thing, right? And I think a lot of organizations today, it's five years ago COVID started. 5 years ago. It's
Right.
crazy. It's crazy. I feel like that kind of tornado of a pandemic that ripped through the entire country. I think a lot of health systems, how they were able to weather that is kind of an indicator of people's of system strength today. And supply chain was such a key component of that. And a big part of it is sort of that, going back to your point about the employees, right? We are an extremely employee-centric organization, right? Right. Fortune 100 best companies to work for I think it's 24 straight years, right? Comp is part of that, right? We acknowledge, hey, we need to pay competitively, right? We have to be. You have to be, have competitive comp, right, for that. So that's kind of a given, right? But during the pandemic, the idea of PPE for clinicians was massive, and the supply chain team, the relentlessness of trying to get what we needed, that's where great leaders, that's where people that know supply chain, know how to operate a supply chain, that's where they're so valuable and contributing. And all these horror stories about reusing of equipment, we didn't really have that, not nearly what you saw at other places. Being innovative with gowns. I remember, right, where it go from masks to gloves to gowns to all these shortages, right? George's team got together with the innovation team, and there was auto supply manufacturers that had shut down, right? And I don't know, I forget how the idea originated, but the material that they build airbags out of, can be used as washable, reusable gowns. So we jumped on that, got all these gowns to the team. They loved it. Right. So it was just that mindset of just got a problem. We're going to fix it. We're going to solve it. And that's the mindset of the supply chain team. And again, I remember I was on a call, I think it was the Florida Hospital Association during the thick of the pandemic, and they had leaders, I think, from CMS on the call. It might have been even a national call, and they said, "Hey, how can we help?" Like, it was the craziest. How can we help? And one of the CEOs or CFOs, I forget, got on the call and says, "Okay, how can you help? All right, three ways you can help: PPE, PPE, PPE." Right? Our clinicians need to feel safe. They need to feel safe when they're giving care.
Right.
And I tell you, George and the supply chain team, just they had that tenacity, and I really think our clinicians felt it. They felt supported, and really helped us through it and built that trust. So now when they want to do things and push new initiatives and do things to help out, it's great. They've endured that trust or engendered that trust.
Well, Matt, we're coming to the end of our time here. I probably could ask you to do about 2 or 3 more sessions because I enjoy talking. I think Baptist is an example that people should take a look at because Baptist is a realizable system size, system structure.
Yeah.
And I think you guys, that the continuity of leadership that I figured out this morning is, to me, and Brian's right. There were no jerks. The jerks were gone,
Yeah.
Yeah. And so it's been my honor to have you on the show. I hope to talk to you again soon, and keep up the good work.
Thank you, Fred. Really appreciate being able to share our story and chat with you.
Thanks for tuning in, and don't forget to subscribe to the show. If you have a topic you'd like to discuss or would like to be a guest on the show, you can reach out to Fred directly at fcrans@stonge.com. See you next time.